All right, so we're streaming. Thank you all who are watching. Thank you all for joining us. Thank you to the Center for African Studies as well as the Center for Gender, Women, and Global Leadership. It's okay. Thank you, no, for real. This is a very, I think, essential conversation. Sorry, I think it's a really essential conversation during an essential time, Domestic and Sexual Violence Awareness and Prevention Month, with several community leaders who are doing phenomenal work in their different fields and spaces. And we're here today for a fireside chat. My name is Nana Grantuo. I am a Howard alum. I am currently working as founder and owner of Diaspora Praxis LLC, and I am going to be moderator for this evening. Before we get started, I just want to make sure to read off your bios briefly, and then we can get started in the conversation. And feel free to converse with each other. So first, I want to introduce Dr. Anjerrika Bean. Pull up your bio. Dr. Bean is a native of Beaumont, Texas, and a proud veteran of the United States Air Force. As a researcher, she's a sociologist and criminologist with a concentration in criminology and inequality. And she is currently the Assistant Director of Howard University's Center for Women, Gender, and Global Leadership. Thank you so much for being here. Thank you. Yes! I like that. Let's clap for each other. Mohamud is a proud Somali American Muslim woman, born and raised by Somali immigrants, parents in the DC metro area. Upon completing her Bachelor's of Arts in Neuroscience and African American Studies, she embarked on a journey to public service and community development through the intersections of science, public health, and social justice. Lul is currently serving as the Executive Director for the Person Center, a nonprofit organization dedicated to supporting survivors of domestic violence in the African immigrant and refugee community here in the DC metro area. Thank you so much for And we have two officers from Howard University's Muslim Student Association. Aliyat Saliban serves as the president for the Muslim Student Association. She's a senior and majoring in biology with a double minor in chemistry and community development. She's from Boston, Massachusetts, by way of Somalia. Thank you so much for joining. And last, but certainly not least, is Haifa Ahmed, who serves as the secretary of the Muslim Student Association. She's a junior here at Howard, and she's majoring in psychology, double minoring in biology and chemistry on the pre-medical track. She's from California by way of Sudan. Thank you so much. And so I wanted to learn from you all. I wanted to learn a bit more about your earliest commitments to community service, what that looked like for you, and how those experiences continue to shape the work that you do now. And anybody can feel free to start.
Oh, I can go first. So I think my earliest memory of self-guided community service, like someone like I was like, I want to go out and do it, was in the height of the summer of 2020 serving through George Floyd, the terror of racial reckoning, also kind of in the midst of the COVID pandemic. And it was actually working with the USDA and local churches to create a food drive for families that were facing food insecurity in my city. So I was noticing that a lot of people, because I worked at Target at the time, and I was noticing a lot of people weren't able to access food. Prices were kind of moderate, but they weren't still able to purchase food. So I was like, there's a problem here. So I reached out to local churches, and I reached out to a few people that I knew that were community leaders, and I was like, we need to do something to address this. And so every Thursday for like 4 hours in the morning, we just started this long line, and the cars just pull up, and we would have essentially like a care package with foods in it. And so I think that was my first like true introduction to like I was self-guided, where I wanted to move myself, and so I just went out and did it. Community service.
And for me personally, it started in 2016 when I started being interested in community service, and not only that, helping the greater community, the immigrant community in Boston, Massachusetts. And so when Trump became president and he started putting the ban of majority Muslim countries, Somalia was one of them. And coming from Boston, predominantly a low-income community, which is Roxbury, we have so many Muslims who are like a lot of them are undocumented or don't know the status. So I started doing it I was a cheerleader for a lot of Somali people where a lot of them didn't know the uncertainty of if they were able to stay in the country. And not only that, just see the passion for more people that look like them. That's when they were comfortable to come to a nonprofit organization called ACEDA, which served a majority of Muslim Somali.
I think to just hop on that, I think one theme that we're seeing so far is that it's really started close to home. I would say service is not it's not like this abstract idea that I think a lot of people may have of it, where it's either constricted or it's, something that you do for a certain purpose outside of, the people that you're serving or caring for, which is really, we could argue, a very consumerist perspective of what service looks like. But I think based off of what you all shared and from my own reflection, I think a lot of my service really began inside the home. I'm one of 5 kids with my parents, and our house, as my sister can attest, people would be coming in and out, cousins, uncles, aunts, community members. And within that unit, within that home, within those 4 walls, we were doing practicing actively service in that sense. People were newly immigrated to the country. Whoever was already here was ready, willing to assist them, whether it was getting them a home, getting them a job, do whatever they could to help them on that journey because someone was there to help them. So when I think of my earliest examples of community service, really was just being able to be there for the people who were there and for the people who were on their way. So even now, with my idea of what service looks like, my sisters and I, alongside our mom, help her run a small little masjid out of a little office space. We go every month to bring community together, find out who needs what, get it to them. So it's service, I think, in my perspective, is extremely personal and extremely proximate.
That was such a good answer. So, community service for me, in terms of major commitments that I thought about when it mattered to me, really threw me off with your answer because when I started to think about it and why it was so important to me, I was like, oh, this is who we are as a people. Community service does start in the house. You do start with your grandmother opening the door and letting people come in. You do start with the people walking down the street that don't have food, and then Granny starts to make them a meal, and then they start to call her Granny. And if somebody in the family becomes homeless, you open the door, you do start there. So I was like, oh my God, it just really touched my heart when it was something. But for me, community service started in the church, specifically in the Black church. My major commitments that I can think about when I go back, right? And it kind of started in the Sunday school class, and we just kind of volunteered and giving back. And then what that led to was outreach. So it led to, we're gonna take the kids to go feed the homeless people for Christmas or for Thanksgiving. Those kind of commercial things that we go commercialize to say we do, but we're teaching kids that there are other people that don't look like you. I was at a mega church when it started to matter for me, right? So we had a lot of kids in our environment that wasn't necessarily poor. They came from families that at least had the basic needs. Their needs was met. So we have to go out and expose our children to basically people don't look like you. They don't have all the resources that you have. And so we intentionally put things like that into practice for us. And so for me, it kind of started there, and it led to me, working for teens and developing all of these other organizations for our teens to be able to go out and do outreach. And we partnered with schools and community, Title IX schools, in the community to do service projects that was centered around bullying at the time. So if y'all can remember, at one point, blackout bullying or these anti-bullying campaigns was really big. And so I would take the teens there, and the teens would go into these schools and talk about anti-bullying practices there. And just, I did so much, y'all, in terms of service. That's kind of where I came from. I was telling the doctor over here, a good doctor, I was about to call you your first name. I was saying that in terms of my service, that we did a lot in terms of outreach, but how it ended up impacting me and where I'm going right now is that the service events that we put on in terms of outreach, we started to work with Black women in the community. And we didn't intentionally work with Black women. We actually intended on working with Black families, or anybody that wanted to own a home. And from that project that we was doing, let me slow down. I started doing service that led to a job opportunity that I needed. I was volunteering with a company called Jehovah Jireh Village, which was a nonprofit that helped families become homeowners. It was a community development center. So we did a lot of things, storms, all of the things that happen in terms of service in the community. That's what the church was about. And so we started to work with these women who wanted to be homeowners, people who wanted to be homeowners. So basically it led to these women becoming financially stable, building their homes from the ground up, securing their finances, becoming more educated, and all these things. But I was the program director. I eventually ended up being a program director from that particular position. And in terms of who we actually ended up being our audience, we built 44 homes, and before we left, 75% of those homes were homes that Black women owned. The majority of them had children, and they were single. So we had a few, married people that was in these communities, but for the most part, it was single Black women who ended up owning these homes. My best friend, my cousin, so you talk about this family thing, or whatever, my cousin got married to one of the women who owned a home back there. My family still lives there. When I go home, they're still there. Or whatever, when I need a place to eat, or a place to sleep, or I need food for the holidays, I go there. So this service thing, in terms of what you brought up earlier, is very personal. And so, I was in a church, and I was doing these kind of outreach services that people commercialize, but really, in terms of who we serve with our family and who we are as a people. So it's been a good journey. Like the service thing is
Exactly. No, thank you for sharing that. Because what you're showing is also that something that I've always kind of yelled about is that community service is not just a one-time transaction. Community service is problem solving.
Yeah.
And it's what we do. It's part of our culture. You've heard of Shalom or where it's all women who pool their cash together to support other people, to make sure that people have those cash transfusions so that they can get that independence. That's not just, it's not just charity.
Yeah. Girl,
It's problem solving, and it's what we do, and I'm always preaching about our communities have the solutions. Just give them the trust and the dignity to figure it out.
That's awesome. Oh, that was awesome.
Love, and in particular, emphasizing the significance of community care. And now moving into this next question, because in particular, we all spoke about faith community and what that looks like. And so as Black women of faith, what do you think, when we think about the role of faith communities in not only the community service, but in particular now when we're talking about those of us who are experiencing family, domestic, or sexual violence? What are the realities or the possibilities of these spaces in terms of intervention and prevention?
No, it's a very sticky topic because as an African immigrant and as a daughter of an African immigrant, and just seeing the women that I was raised around, a lot of them have faced domestic violence, whether it is physical, mental, financial, which is a big one. And so I think a big thing when it comes to communities or intervention more specifically is it doesn't happen a lot because it's not talked about. And so we run into this issue of women who do face it, and you see it, everyone can see it, but no one's talking about it. And a lot of it is the fear of going to ask for help because it is a new country, and a lot of times when you come here, it's you, your spouse, and your kids a lot of times. And a lot of times the women don't want to leave or are scared to even ask for help because it's I can't let these kids down, right? I can't break apart the family. And kind of the community around her wants to help, but they don't know how to help because then they themselves don't know the resources to address that specific topic. We'll help you out when it comes to getting paperwork done, right? If you need a translator, one of the kids will come and translate everything for you. But domestic violence is something that even back home isn't talked about a lot. So those resources, we don't kind of know these resources. So I think my generation, I remember when I was talking about mental health with my mom, she'd be like, oh, do you want to go talk to that lady that she's going through it? And I'm like, I'm 16. I don't know what to tell her. But they need it, but they don't even know how to ask for it. They don't even know the language of this is a problem. They know what it is. They're like, why am I, sad 24/7? Why can't I go out with friends? but they don't know how to articulate it, you know what I'm saying? And so it's just, there's a need for intervention, but there's also a need to start having these conversations with the women around us. And it could be really hard because you're telling them, like, after 10 years of living in this country, hey, the person that you're with, they might be causing, abuse, and kind of coming to terms with that. And okay, so what do I do now in this new country? Because let's say back home that does happen, they have families to go back to, right? They have their mom, they have their aunties. A lot of the times here it's just them, their kids, and their spouse. And so it's a heavy topic, but it needs to be talked about. But it's like, where do we even start? So that's just been my experience with faith-based communities and youth intervention. Interventions.
That's really good. And I want to piggyback off what you're saying. So many thoughts came up while you were talking, specifically for the Black community or African American community here. Black people were more prone to report all of our social ills to the church, to the Black church specifically. That's how I said the African American community. Like 79% of us still have a church membership in the Black church, and because of discrimination, race, and all of the social ills that we face and our mistrust of the police, then we're more prone to report to the Black church. So for us, there is a need for the faith-based community to have systems in place that address those ills, So, and it's not just dated back to, it's not just something that's happening right now. It dates back historically. We've never really trusted the police. And the church was the first place where we had land. The first was the first place where we were able to bear our own. The church was the first place where we was to have able to have economic cooperation or whatever, for us to come together and to work together in order to serve people. The church still serves that purpose, and because the church does serve that purpose, then we have to put systems in place. Not that we should have to. We pay the government, we pay taxes, and they should do it. Or whatever, but they don't. Or whatever, and we don't call police because we don't trust them. And since we don't, and we have to go to the church, we should have systems in place where the church can actually address these issues. So we can kind of get into some of the specifics. I do agree with all of the barriers, right? When you have financial strain or whatever, there's double income. You lose one of those incomes, you can't pay for your children. What about the women that don't have any income at all? And they're totally dependent on the man, in these particular situations, and they don't have no outlet. And things, and there are conversations that we should have in terms of us being able to be successful. You mentioned earlier that we're not having these conversations, but we're the ones who have to address it. For me, one of the things that I wrote in my notes was that Black women serve as first responders.
Yep.
We report informally to each other. I'm not gonna call the police. I'm gonna call my girlfriend. He beat me up, and that just happened before. I'm not making this story. So I've had a girlfriend right down the hall within the same apartment complex here in Silver Spring. We were in school, and she ran down the hall or whatever, knocked on the door, and dude was dragging her, punching her in the stomach, kicking her, stole her car, and I'm asleep. I get a phone call. She then called Howard Communications, and we're on the phone. I'm confused or whatever about what's going on. She opens the door, and she's like, telling me what's going on, and she's frantic, and I'm like, well, let's call the police. No. Don't call the police. Don't call the police. He already has a felony. Black women don't call police. We don't want him to be overseen. We don't tell on him or whatever, And so for us to have these conversations about what do you do as a first responder? Now, I happen to study domestic violence, right? So, and she trusted me. I'm in the ministry. So a certain level of friendship and things about me that she could open up and say and could trust my advice. But any other girlfriend had to be equipped on how to handle that. So I was able to convince her to call the police or whatever, Let me tell you something. She called the police. She did a report. She was with the guy the next day. So understanding and being gentle is important or whatever, in terms of what we have to do or whatever, because she's not more likely to leave in that first incident. She still wanted to see him, wanted to talk to him, wanted to closure. He was visiting, things like that. And so she was with him the next day. Eventually, she did leave the relationship. She was strong, and she's incredible now, great in life. And she had her reasons. She's economically strong. She's agreed or whatever. She has her own money. She has her own resources. So she don't have to stay. She had no children with this guy. She don't have to stay. But another woman that's in another situation will look totally different. But as first responders, what do? You want to have a plan in place, and you want to be able to talk about this plan on how to go forward sis, this is how you prepare, this is how you put your paperwork together, or whatever, these are the documents you need for your children. These are the resources you need. You need a domestic violence shelter number. You need to have all your kids' paperwork together. You need to have enough money for bus transportation. You need stuff like that. That's going to help you. So to your point, we're not having the conversations, but we need to be trained on how to deal with these situations when they come to us, because we're talking to each other. We're not talking to them. I am my sister's keeper. That's all I am. So that's my response. We have a role.
Truly, I can't thank you enough for being able to also, really show us that this conversation is deeply personal. It's deeply personal. We're pulling this from our communities, from our families, our most loved ones. In our work at TPC, exactly what you just laid out in terms of the fact that we are our own first responders. And it's always been like that. And when I speak about, the African immigrant community, a lot of what we do and how we're doing it is following a system set by the African American community here. So just as you mapped out how the church is central, it is a place where people go to discuss what's going on. Your spiritual leader is generally the first person you go to with any problem that you're dealing with. The community has systems set in place in responding and supporting individuals. A lot of African immigrant mosques and churches function exactly that way. And so when we are talking about, how do we address the reality that we are our community's first responders, it really is, and this is a method of the person-centered, it is to teach and to prepare and to train those people who are going to, whether they choose to or not, be first responders in this case. Because the challenge is, our faith communities are living entities, right? So that means A, they're able to change, but B, that also means that they have issues, they have ills, they have obstacles that they come with. And unfortunately, what we're noticing is that our communities, just as we may be ill-equipped in terms of translating what we're feeling and seeing into acceptable terminology or into prognosis, we know what's going on. Like in Somali, there are words for paranoia, for schizophrenia, for anxiety, for depression. They're just not those words. You won't find them in the DSM-500. You see what I mean? But what you will find is that there is an understanding of it. There is a response mechanism.
There is a response.
If somebody is vulnerable in a family, the family will adjust to protect that person. The only issue is that we are also, and unfortunately, as once colonized countries, and I argue now neo-colonized countries, and also communities that experienced oppression and slavery, what we're dealing with is the infiltration of white supremacist notions. That means, the way that patriarchy has deeply entrenched and become the priority above the lives of women, which is the exact definition of it. That the life of men is most important in comparison to the life of women. And one of the major challenges that we have is that women are overburdened. Our cases are so complex that it's hard to navigate. And we can't apply the same algorithms or formulas we've been given in violence prevention to this community. We cannot. And when we do that, that's when we fail. Currently in the United States, our domestic violence response is still heavily dependent on who? The police.
And why?
And that's incongruent to the communities that we work with. Because when the survivor in that case is synonymous to their description of a criminal, there is no way that person can be treated as a victim or cared for.
Or the angry black woman.
The angry black woman, the one who doesn't speak English, how that makes you into a threat. If you're undocumented, you don't want to be here. Any form of police.
No legal assistance.
If you look a certain way, we wear hijab. That instantly paints you as what? A threat. You're immediately downgraded as a human being. These communities, these people live those experiences, so they know that that's not an option for them. And yet, the domestic violence response system continues to rely on systems that don't serve us. And then on the other hand, are consistently telling us that we are ill-equipped or incapable of recognizing our own problems.
As if we're not already handling all.
As if we're not already handling. That's why I say our communities are perfectly equipped to solve our own issues.
Agreed.
that the solutions lie within us as well. So when you mentioned how, first of all, you also showed how eager our communities are to learn new things, that they're ready to enlist a 16-year-old. Because the moment we see a possible resource that can help us, we're willing to bring it in. Because we need it to solve our problems.
We need each other.
So all that we need are additional resources and people who listen, and who better to do that than the community itself. That's the only way, that's the only response we have. And if we're honest with ourselves, when we talk about mental health, when we talk about violence intervention or prevention, we only have a colonial set or understanding of that. Our communities are afraid of mental health care, not because they don't understand it or they're ignorant or backwards. It's because what mental health looked like in their countries was asylums or being heavily medicated and removed from your community. That's the fact. That's history.
Right.
That's history. In some cases you can go to right now, for example, the country of Algeria is a great example out of the tragedy that occurred there, where people were pulled, heavily medicated, and put into asylums, tortured and beaten because they were labeled as mentally ill. And it was part of French colonial tactics. So when our communities are afraid of getting mental health care, don't demean them or say they're backwards or they deserve what comes to them. We have to realize that they have the solutions, listen to them, and let them lead. You see what I'm saying? Therapy exists in our community. It's when we sit down and we drink tea and we do our hair and we talk.
Right.
That's therapy. That's better than any cognitive behavioral therapy methods that you'll find in research.
Let me read your stuff, bro. We're going to get to this.
Exactly. That's exactly it. My own mom talks about how there was a cousin of hers who was in an abusive relationship, and when she was ready to go at her time, even when she wasn't, the time she would call, say this is going, she always met her with patience and understanding, knowing that she may go back. But the day she was ready to go, they figured it out. 3 generations figured out a scheme to get her out of there, and it worked. So don't tell us that we don't have the solutions. The only thing is the complexity of the burdens and obstacles we have are so large, and we probably don't even understand them to the fullest extent. But that's when we need resources and we need support, and that's when we need to take education and understanding from the ivory tower, bring it down and translate it.
Exactly.
Not just translate it, actually, I'll take that back, but we need to interpret it. Have you ever tried to put a paragraph in Google Translate and then try and regurgitate that to somebody? That don't make no sense. You have to interpret it for our communities, but that takes respect. That takes care, and that takes time, and that takes resources. And those are 4 things that they do not give to Black women, and they sure as hell aren't going to give to immigrant women.
Yes.
Y'all over here preaching. I want to now turn to Dr. Bean, because you published an important piece. You were out in the midst of the pandemic, surviving COVID-19, increased domestic violence, marginalized communities, and innovative solutions. I love that. Innovative solutions more than anything. What does your work unveil about Black women's experiences in terms of Black women survivors throughout COVID-19? And in particular, as you were shaping the recommendations, which I felt were very solid for policymakers and practitioners, how key has intersectionality been for you?
Well, that was a lot. I think it's important for us to talk about what happened during COVID-19 and domestic violence. So one of the things that happened in COVID-19 and domestic violence is that the numbers started saying that they were decreasing in terms of reporting, you know? So, and it would be very naive of us to think that they were decreasing because domestic violence was going, you know, was decreasing. Exactly. But what was happening was that women didn't have opportunities anymore to be able to report. A lot of women report domestic violence from all of the things that we kind of talked about before, whether it's through informal networks, rather it's through the church or through institutions, you know, such as hospitals, right? And so if you're not able to go to the hospital because it's packed in a hospital and they're not letting everybody in, they're turning most people then these women didn't have any other opportunities for them to be able to go into a hospital and get that help that they needed. And not only were you not able to access resources at this point, and now you're actually locked into a physical space with your perpetrator. There was a mandatory lockdown where people was not physically traveling at all. Even when you were working from home. So now you're trapped in with your abuser for hours at a time. Your children, nobody's walking. Remember in the beginning, nobody was walking around, nobody was doing anything. So women didn't have access to particular resources. Well, when you think about that, and you think about that in terms of intersectionality, right? Or you think about how we face multiple forms of oppression rather than race, class, gender, and how you actually show up in terms of your positionality in life, the problems was exacerbated, So you're sitting at home with your abuser, he's abusing you. You can't go out, you can't get any help. The numbers are declining and there's no resources. So basically what I looked at in terms of my research was the ways that different communities was impacted. My sisters over here talked earlier about them being immigrants, right? Not only do you not call the police or whatever, then you face the fear of discrimination. Am I going to lose my legal paperwork? Am I going to have, am I going to be considered disloyal to my community, to my families? Are they going to disown me? So that was one of the things that I looked at. I looked at the LGBTQIA plus community, whose numbers, they basically are not out, whatever. So they're in their house with their abusers as well, and they're not able to expose who they are. They're not even able to turn family members, because some people, even if your family may know you are part of the LGBTQIA plus community, they're not even telling you. They're not out, so they're not exposing who they are to their families to even get help. So in terms of our informal networks, they're not helping. What else was happening during COVID-19? People were losing jobs, services jobs. The women who typically serve in these particular positions was losing work, losing income, and so now you're totally dependent on this man or whatever. We talk about women, but I don't have conversations about domestic violence and mental violence without talking about men. They experience it too. They go underreported too because it's not part of, in terms of their identity, they just don't report. But we're talking about women. They're losing their income. Now you're totally dependent on this man who's you're stuck in a house with, who's abusing you. There was no out, for these women. And so we're having this conversation, this broader conversation in society about the numbers declining or whatever, in a particular community, the access of resources being shut down, domestic violence shelters shutting down, how many people can actually go, even if you were to report. Then the shelters wasn't holding as many people anymore, or whatever, you can't move. And so they had to start to looking at different policies and put in place to help these women, or whatever. So what kind of policies should we put in place? And those were the type of resources that I wanted to gather in my research and put in one place. We needed to look at innovative ways that we can address these populations. Number one, you have to understand the plight of a Black woman. I'm not calling the police. I don't trust y'all. I am the angry Black woman. I am discriminated because of my hijab. I am discriminated because of my dark skin. All my light skin, as long as you identify as Black, you're going to be discriminated against, So you had to consider what was going on with them and the intersections that they had in life. So centering their stories and their narratives had to be important in terms of us being able to go forward. What is going to happen to our women, our people, and how we're going to tell our own stories? You can't tell us what we need to know about our communities. We know. So there was one thing, and then there was other innovative solutions that came up as well, or whatever. So instead of women actually being able to call, because now you can't use your phone, he's looking at your phone like you got your phone, he's throwing your phone, you can't use your computer, or whatever, there were other things people had to implement. So it was, some countries put in where you can actually report at pharmacies. You still got to go get medicine with the kids sick. You still have to go to the grocery store. Go to the grocery store. Or whatever, you could call the police from the grocery store. They put in systems where people can go to these different places that seem common and normal to be able to report. So that was some of the practical things that they were doing on the ground that I wanted to talk about in terms of how do we respond. Some countries did put in economic plans in order, to teach culturally responsive sensitive practices for the police, for prisons, for things like that, for them to be able to answer us. So that there was apps that people was creating, where your phone, if you pick up my phone, it looks like I'm going to a weather app, but really what I'm going is to a domestic violence app. Other than I'm learning education and resources and all of these things, and it just looks, and it's a PIN number that's attached where the person can't just get into the app. So there were different resources that people was putting into place in order to address these different populations. So I wanted to look at gender-based violence, the LGBTQIA plus community, Black women, whatever, all of our marginalized communities and some of the struggles and issues that was already there. And look at the ways that other countries was answering these particular issues and talk about those issues in a practical way. When somebody else read it, they can say, and we can do this. A policymaker can say, we can start having phones in pharmacies. We can start having phones in grocery stores in order to be able to help people. People can develop apps or whatever to be able to help people in terms of the church and how the church shows up. There's websites. Even if you're not physically going, I'm just clicking on my website and it's an incognito website that leads me to the domestic violence resources. It was ways for us to do it. And I wanted to pull those resources together to put them and say, hey, this is where we've been. This is what is happening, or whatever, These are some of our struggles. These are our intersections. This is how we show up. This is the pushback that we get. This is why this is happening, but what can we do to resolve it? And so that's why my research was based on all of these different intersections in life. And then, but mainly my goal was to make sure that we have practical resources in the work for us to be able to talk about it.
Now I wanted to turn it over to Lou. I wanted you to share a bit more about what you learned in your work at the Person Center, in particular about African immigrant, Black immigrant survivors. And I really wanted you to also take some time to talk about restorative justice traditions and how that is centered in your work.
Oh, most definitely. First, I want to make sure, emphasize again how important it is to have Black people, but specifically Black women in research, creating resources like this, because your resources will directly be able to use to get more funds towards our work. Because for so long, when people say, oh, if it's not in the research, then it's not a problem, and we won't send you money if you can't prove that it's a problem. Because our voices, our stories are not enough. Even though we are primary resources in our own world, we're not enough or credible enough in that case. So this research is really, really important. And one thing before I get into my section is the importance of how you showed that in this pandemic, one of the things that we found was that accessibility could have been a priority if they wanted it to be before the pandemic. So being able to reach people who were quote unquote unreachable, it could have been done if we put the resources and interest into it. But instead it took a global pandemic for us to care enough about being innovative. And so I really wanted to highlight that point as well. So to your question about our work, first and foremost, TBC is first and foremost, it was created by an Ethiopian social worker. She was Ethiopian immigrant, Amelia Misailetis, and she was just dedicated to making things happen because she knows that our community, we're always making a way out of no way because that's the only way. And so she was really dedicated on the ground as a one-woman show most of the time, getting the voices of survivors out there, because when we talk about the term marginalized, it's 4 or 5 times more than you could imagine for individuals who are living at the intersection of so many minority identities. And so, as I mentioned earlier, how complex it is in terms of navigating not just domestic violence, but navigating the domestic violence response world, it's way more complicated than you could ever imagine. And so the first thing I always like to highlight is our on-the-ground people who work in the field, who are connecting with individuals, hearing their stories and trying to make solutions work for them, are the only ones who truly have an idea of what's going on and an understanding of the lives of people who are forced to live in either shadows or live in those margins. My case manager, Nawai, is over there. She's been with TBC longer than me, and what she really sees is first and foremost that our survivors are not only burdened with the challenge of the traumas they experience here with abuse, but many times they're also burdened by the traumatic nature of navigating the immigration system. The traumatic nature of learning a new language in a country that doesn't give you time to learn. Also, the trauma of having to raise children, some special needs children, in a country where if you're not hands-on with your Black child, then you're going to be giving up power to everything else around you. Then on top of that, the only person that you knew that either brought you to this country or you met here when you were vulnerable, now that individual, the only other person that shares your culture, the only other person that shares your language, the only other person who may share your religion, now that is the person that is causing you the most physical harm, emotional harm, financial harm, spiritual harm, psychological harm, reproductive harm. What we forget to identify when we talk about domestic violence is that survivors, first and foremost, this partner they were with, they cared about them at some point, if not continue to. And that's the most heinous nature of domestic violence. That individual that you loved and cared for is the one who is now harming you. That we have to recognize the complexity and the harm in that if we want to be able to have empathy and understanding and gentleness towards survivors. Now picture this. You've come to a new country from your community. You're working very hard to learn the language, to make money. If you're undocumented, you're making money under the table. That's the reality of it. Where you're also at higher risk of exploitation from your employers. You have a partner who may be documented and your documentation is directly connected to theirs. You have children. If you're being threatened that if you make a mistake or if you say this or if you do that, your children will be taken from you and you'll never see them again. You could have left an abusive or dangerous situation back home and been threatened to being sent back. Then on top of that, you're also not surrounded by community. There may be a few people from your tribe or from your country that are in isolated parts of this country, but if you don't know where you are, if you move to a new country, try navigating it on your own, without transportation, with children, without a job, without those finances at your disposal. It's extremely difficult, and it's important for us to really bring reverence to the complexity and the fear just in that reality. And we're just thinking about it hypothetically. That is someone's reality. And a lot of what we do, what I've noticed, at least in my role, is that my advocacy work just starts with awareness. Because I don't believe people have the empathy or the understanding to realize how hard it really is for the survivors we work for. Because no one has respect or care for the needs of Black women, and no one really, everyone assumes, we already know how everyone assumes Black pain is not as bad as everyone else's pain. If we're talking about literal pain medication, but when it comes to the emotional burden, the physical burden, the psychological burden of that experience, I do not believe we've held it in reverence enough. Because when we do, that's when we're able to actually respond correctly. That's when we shouldn't be having petty squabbles and finding out who gets an extra $5,000. Where organizations like ours shouldn't be fighting tooth and nail, submitting 60-page grant applications for $5,000. Where our survivors shouldn't have to sit by for weeks waiting for us to get them $1,000 to make sure they don't have to go back to their abuser. When we look at that situation, we realize people don't have a reference for the reality of these survivors. So a lot of what I'm doing is, and a lot of what my case manager does, what our team does, which is so frustrating, is that we're trying to show people to treat us with the dignity that we deserve, as our organization is built and run by other African immigrant or Black women. So I'm not just doing this for the survivors because it's a nonprofit I care about. No, this is for my community. This is for myself. It's extremely personal. And like I said, service is personal. And in order for us to be leaders of organizations, we have to be proximate to the problem. I'm not just going to take 6 figures and say that I'm a nonprofit leader. No, we have to be realistic with ourselves. The real people who are doing the work are those who are on the ground and going back to those communities that they live in. And to get to that second part, like I said, our organization was made by and serves African immigrant women, and is made by the Black diaspora in particular, as we know that all of our problems are interconnected, and it's important for us to work together. This aspect of reproductive justice is not new, restorative justice, they really do go hand in hand. So there is no falsehood in that statement. But restorative justice is our culture. It's our culture. Because what we realize is that individuals in their lifespan will cause harm. But that does not define who they are. Justice people will be harmed. But that experience of harm does not define who they are. We live in a binary. You are the one who causes harm, you are the one who is harmed. If you are the one who is harmed, you will forever be labeled by that. You are forever seen as weak. You are forever labeled by the mistakes made or so on. And if you cause harm, you are to be incarcerated, you are to be punished and labeled as such. And once again, that's only applied to Black and brown people.
Yeah.
Period.
Right.
And so it's really important for us to know that restorative justice is what we do in our communities. If people are having a conflict, we know we can't turn to the carceral system because they'll take everyone. They'll either take your child, they'll take your family member, we have a lot of people with multi-generational homes. If you have an elderly dependent, you have to think about them, what will happen to them, where will they go? So we have to recognize that our communities are already practicing restorative justice, and they're looking for that. And so why can't we once again listen to the communities who have the solutions and integrate them? And so our organization is in its relaunch, it's relatively young, we just closed 1 year, but we are looking to listening to the community and seeing what they're looking for. And as people who have been victimized by the carceral system, who have been victimized by police, we know that we also want another answer. So if we have the skills and the few dollars we've been able to scrape up, we're gonna try to make it work, which begins with just listening to the community and choosing to reimagine what violence prevention, intervention, and restoration can look like.
Conversation on such relevant points, so many of us, specifically with this whole restorative justice piece. When you think about just what we've been historically, and I was talking earlier about how we advance our own communities, and a lot of my work is grounded in faith-based community in the church, because that's where I came from. But when I think about, the restorative justice piece, I think about deacons coming to knock on your door when you're having problems with your man. And them saying, "Come here, brother." Like it's time to have a talk. They come and knock on the door to get the guy together to say that, hey, this is not the practice, what we're going to do in our community. And those are real things that happen. The deacons get together, the men in a church, if you're close enough to the church in terms of proximity and they know who you are, they come and they have these conversations with people in the church on how to get it together. And it's happening with the women too. The women are leading the other women, like the whole, you train the next generation. She's saying how to manage her house. She's saying how to deal with if he's abusive. She's giving her tips. Like, we are our sister's keepers. We are our brother's keepers. And to your point, we are the restorative justice system that we need, and we just need to put some respect on that.
Exactly.
Just put some respect on that. Your point was like so, probably just stood out so much. Like, yeah, we do have these practices, and we just have them in a lot of informal ways, but if we can kind of put some of the systems around and make it a little bit more formalized, not for them, not for necessarily even the institutions, but for us, it would make our communities thrive in ways that they haven't thrived before. And I really like what you said in terms of talking about the offender, the victim and the offender, because at times you can be the victim and at times you can be the offender, and some of us have played in both of those roles, And so for us to understand that you're not always going to be the offender, or you're not always going to be the victim, or whatever, I think it's extremely important in terms of us going forward. And it does allow for us to heal and us to be able to forgive and us to be able to move forward in a very healthy way. And until we can kind of get to that point and to that point, and stop putting people in these binary categories, we're not going to be a good society. We're not going to be able to go forward. We need to get to this point where we're able to see that people are not perfect. They deserve another chance. They can heal, and the family can be restored. It's important for the family to be restored. You talked about the generational piece, right? There's a grandma in this house. There's a grandfather in this house, The money is small. There's not a lot of us. We got to lean on each other. We can't continue to tear our house down, and maybe he don't want to tear our house down. Maybe you don't know how to deal with that. Maybe you don't know how to deal with separation. I don't say that to be stupid or callous or to say not to tap out or leave when you need to. But I say that if you can infiltrate, and if you can, have a piece where we can come together and we can work through these issues, and we should consider ways that we can do that in a healthy way. Not the idea of pray and stay.
You touched on it exactly.
Yes.
Well, the systems we have, the informal systems we have now, have a horrible flaw in them, a systemic and generational flaw in them. And that is that we put forgiveness before accountability.
Yes. We want to hold you accountable.
We put forgiveness before accountability.
Yes.
And that's actually a really integral part of spiritual abuse.
Yeah.
Because as we say many times, that a partner is not just an abuser. The communities can serve as an abuser, the system serves as an abuser. What we need to realize is that we are, in our communities, we are adopting ways that are the antithesis to what we believe in, whether that is our faith, whether that is our culture. We don't believe in protecting abusers. However, we have adapted that in our cultures and our faith. And unfortunately, I can speak at least for the Muslim community in particular, what we're noticing is that we are leaning towards creating exit routes for abusers because we are adopting pieces of patriarchy as our faith.
Yeah.
We are adopting, and in the Muslim community, we are adopting aspects of Islamophobia into our own faith. And it's an extremely complex conversation, but there are a lot of parallels.
I want to talk. Can I read a paragraph?
Go for it.
Okay, so this is just talking about the Muslim faith, right? And this has come from a research of my dissertation where I deal with domestic violence and domestic violence reporting in the faith-based community. And I brought one of the quotes in and talk about something that one of the Black women said about her experience and experiencing domestic violence in a faith-based community or reporting to the church. So it's going to be a kind of choppy because I don't take away from no words. I read it like they wrote it, like they said it. So it's a pseudonym, Keisha. It's a pseudonym. Keisha say, I think it's a cultural thing in the Black community that we don't report abuse because, to be honest about it, if I really think it's a systemic problem. Because as a Black woman, my first contact should have been to call the police and stuff, but it's so systemic. I've been pushed to believe, don't call the cops on him, He didn't mean to do it because that's what you grow up with. That's what you hear. That's what is put in front of you, don't call the cops on him. So then you don't. So then what do you run to for your answer? The church. Because you think, oh, they will help me, they will talk to him, he will get it right, but the Black community the Black man is not really bad. And I'm not bashing him, he's just not really ever held accountable.
You can translate every identifying factor. Switch it to Muslim community, switch it to Imam, switch it to whatever you want to. Black man, switch it to African, insert any country.
Yeah.
It is exactly word for word what survivors are saying in this community as well, which shows us what we need to also be interconnecting through faith lines, through culture lines, through language lines, to realize we are all facing the same problem in separate corners of our homes and our communities. And part of that is that we are adopting we talk about misogyny, right? About how the reality is that there are Black men who want to just kind of run the world as white men do. And what we notice is in our communities, Black men, African men, those who are identified as men, are making it a prerogative of theirs to apply the white man's rules to themselves in the community, not knowing that sense of power is derived from direct harm of those that care for them the most, who protect them, who think of them, who in essence are keeping their existence alive. And so as long as we are dedicated to that notion, we will not find reprise. We will not find safety. We will not find sanctity. We will not find comfort.
Right. In essence, and reality, right?
And it's not our practice.
Yeah.
It's important for people to realize that it is possible for you to detach yourself from that image or practice because it is inherently not ours.
It's not who we are.
It is not who we are.
Yeah, agreed.
And you can see that evidence through the symptoms of how it affects the generation after, how it affects the individuals around it. It's a sickness. I always say whiteness is a sickness, because it's not real. It is a sickness, and we have adapted it, we have layered it, we have covered it, we have clothed it, because part of that gives somebody back a sense of power. Even though that sense of power is a direct result of the oppression of another. We have to remove ourselves from that kind of need to have it, because what we're doing is we're also finding women upholding that practice among other women. Forgive him and go back to your home. You know, think of your children. Our only response should not be for Black women to continue to sacrifice themselves in extremely dangerous environments, because what we find is another Black mother killed, children killed, grandmothers killed, by their own sons, by their partners, by their siblings. It's a sickness. It's not us. Let's continue to work the best we can to realize that it's not us to continue this. And I want to pull this to you two as well, because what you're able to do is really offer us an insight from your perspective and what you see in community. As I said, we're all experts of our own experience here, and so I know you have questions, so
Go ahead, it's okay.
but if you all have any reflections or anything that's kind of come out to you, please feel free to.
Yeah. There's a wow. That's amazing. But when it comes to, because you talked about white supremacy and how in specifically the Muslim community, we kind of changed it, we mixed it, and we just kind of manifested it in our community. I'm Sudanese, so it's the Black, highly controversial Arab, and I was born and raised in an Arab Emirates, so I was born and raised in an Arab country where a lot of them, they tend to see themselves as white. And so a lot of like within the Muslim community, you talk a lot of like Black Arabs, like Black Sudanese, Black Somalians, Muslim Sudanese, Muslim Somalians, Muslim Ethiopians, they tell you a lot of the times, I don't feel welcome in my own mosques that are not Black mosques. Because a lot of Arab people, white Arabs, or even Pakistanis or Afghans, they kind of project this like, you're others. Even though we're all the same faith, you're others. And so that's why when we say faith-based community, the first time for me personally, I felt a Muslim community was when I came to Howard's MSA, because it was Black. And even when I talked to a lot of people from George Washington University, Georgetown University, the Black Muslims, they're like, oh, we don't go to our MSC, so we go, why? It's a lot of Arabs, it's a lot of Pakistanis. So we can't even find safety in our own religion sometimes. And so that's why it's really important for us to find safety in each other. I remember one time this Imam came, and Imam is essentially the, Johari. He came and gave the Friday football, like a Friday service sermon, and he said, when I look at the sisters, when you guys look at each other, it's almost as if you guys are in love with each other. And it's because we found safety in each other. Like a lot of us come from communities where it's, let's say I'm part of the Sunni community in California, right? It's you, the few Sunni people in your city, that's it. And the only time you have the big communities when there's like Eid celebrations, or there's a big event, or when like you have a barbecue with each other. But there's never like, there's a few Sunni girls in my high school, so I have a community there. You usually don't have a community. Until you get to a place like an HBC or a Howard, or until you get to like a metropolitan area where there's some Black mosque, you know what I'm saying? And so a lot of us, I think we are finally learning that, hey, I can get help. A lot of us realize, oh my God, I need help. Oh my God, I was ignored. I wasn't respected as a human. And then to add on to that, if you are a hijabi Black Muslim, that is an entire different topic of having to defend yourself. And like when it comes to domestic violence, I can give you like a few stories of women in my community where I remember one of them, their daughter kind of was going through mental issues, and I kind of was the story of the community because I went through my mental issues. It was very kind of public, and so I was highly depressed and anxious and suicidal thoughts. And alhamdulillah, things to Allah, I kind of got through it. So after that, I kind of became the spokesperson. So every mother that had a daughter or a son that was going through something, they'd come to me like, hey, we don't know who to go to. We don't want to go to the counselors. We don't want to just like, can you help us? And it's just kind of being like, me realizing like, we don't have anyone. We have people, but they're so far away that it's literally kind of like a weird thing where like you have services, but it's where are they? And you're too scared to reach out to them. And it's, I don't know where I'm going with this, but it's being a black Muslim woman is insanely hard. And so it's kind of like when you finally get to a space where you're heard, you're kind of like, it's almost let's say these 18 plus years of just comes out. And it's 4 years, I'm just really saying undergrad, of healing. And that's what kind of our MSN kind of like saw when we had this, we had this event called China Chat, where we kind of inspired by the Digital Sisterhood. I don't know if you remember the sisterhood here. So they're a bunch of Somali athletes that kind of talk about anything related to being Somali, being an immigrant, being Muslim, being a woman. And one of the episodes was about, her name is Hernaz, that's the title of the episode. I encourage all of you guys to listen to it. It was about mental health in the Muslim community and the immigrant community, and the African immigrant community, that finally discuss suicide and just really like heavy things in our community that we know exist, but we never talk about, and we never think we're actually coming to life. So when a lot of us heard that interview, we were like, okay, we need to have this conversation right now at MSA. So this literally event, we heard the podcast on Friday, the next Friday we had this event. And so I remember like, I thought it was gonna be 20 people are gonna show up, gonna be, like quick little questions and we're gonna leave. But by the end, it was flying. It was breaking down barriers. I remember I went to our advisor, actually, Mohamud, and I was like, what did you just do, guys? She was like, I just asked you guys questions. But it was questions that let out years of trauma, and years of us finally realizing, oh my God, I'm seen, I'm heard, but most importantly, I'm respected. And so I think as MSA, especially as leaders of MSA, we have this like role of like taking care of a lot of people that never had the spaces, and now we kind of have to create the spaces. And a lot of us, this also is our spaces. So it's kind of like, it's interesting, but we're trying our best. But listening to people like you and the research that you do, I personally want to thank you. At 60-year-old high school, I'd like to thank you. Because I know that the future generation will at least be a little bit more protected than us, you know what I'm saying? So yeah.
And going off what Hazel was saying, I think as Lou was saying, the importance of having people that look like you, because a lot of times when you don't have someone that looks like you won't understand what you're coming through. And like the episode that we had, like her name is Hannah, like the mother had mental issues, went to a doctor and told her, just take pills, you're gonna be fine. And then a few weeks later, jumped off the building. Because no one listened to her, no one gave her space to grieve. And I feel like with our communities, because we're the new generation, the Gen Zs, we understand that there's a lot of conversation that we always bring to our parents. We talk a lot, like we have a lot to say. It's because we are not uncomfortable of speaking. And that's the thing I feel like with our, like, coming from the Somali community, a lot of times certain conversation is very taboo. It's like, they're like, no, let's talk about home, don't say it in front of other people. But with us, we're like, no, come being at HBCU, being part of MSA, being leaders, we're giving space to other students, letting them know, it's fine. I know where you come from. I know the immigrant community you come from. Even if you're not immigrant, you're African American, I know that we have a lot of like the way we're brought up is so similar. I understand. So like we have created a space where you can come, share your experience, and that space, whatever you say, is not gonna leave. And I feel like what we're fostering within MSA is amazing so far.
That's how I really wanted to bring you to because because we're offering such first thing that from my work, Maya is identifying where are the problems here. What you just showed was a clear image of why people are always like, well, we created this resource, but it's underutilized. Where are the people you said were here that needed this resource? But the question is, how are you offering this? Is it really just a desk inside your building that nobody's gonna come to or wanna come to? You see, you talk about the importance of counseling. In violence prevention and intervention and response, we talk about counseling, but what we don't talk about is the reality that if you go to a counselor as a Muslim woman, your counselor will most likely, the only understanding of Islam that they have is Islamophobia, and will tell you that the cause of all of your problems is your faith. You have to leave it. We've had people tell us that that's what they were told. So now this woman is not only taking the courage to be able to step forward and get help, but everywhere she's going, she's being told that part of who she is and the things that kept her going are the cause of her problem.
That's white feminism. But go ahead.
That's truly.
It's it looks different amongst, people of color. We talk about Black feminism, when we talk about the different strands of feminism and how we show up for each other and what that looks like in terms of what feminism looks like and what equality looks like. For us, but your white framework don't fit for my Black body and my Black mind and my Black experiences. So we have to be careful in terms of who we, even go too far about them. When you brought up such a prevalent point, because my brain always goes when you bring up a problem, I'm automatically trying to connect it to a solution. But when you said it, I was like, oh my God, what's the solution? And I was like, oh, we need more Muslim counselors, or whatever. So I should have those outlets for y'all. But so the other point, which I brought up something I thought was so beautiful earlier, that I want to kind of bring back up and highlight. You said that when you got to campus, whatever, you see, they say when we look at each other like we love each other. That's sisterhood. That's how university, that Black sisterhood, that woman sisterhood is so real. Like, we do look at each other like, I know who you are. I'm so excited to see you. I'm so in love with who you are and all of the things that you're doing, and we affirm each other, and we're able to heal in that space. And I think it was so beautiful that y'all brought that up in the context of this subject, because it's so harsh, and it's such, it's so much pain that's in it. But to think about the fact that it's so much pain and it's so harsh, and that's the world that we exist in, but we find love in each other. We find love and we see each other in our community, and this is our healing space, this is our safe space, this is where we're able to grow and to develop, or whatever. And for me, specifically for how many persons to be able to reconcile my faith and who I am as a Black woman, is awesome. But the fact that y'all have that so young, I think is incredible, and it's something I really want y'all to just take the time to cultivate. And like you said, in terms of your work, in terms of bringing awareness to it, right? We're not talking about it, so talk about the space of love for Black women, for Muslim women, talk about what that looks like verbally, so that other women can see exactly what world that you're living in terms of your psychology and your subconscious, the world that you're living in, to be more outspoken about what you see subconsciously, because it is a beautiful, beautiful, beautiful thing.
And what you guys showed was that, you don't so did. That they don't have letters behind their names or whatever, yet you have the ability to help, help people get on their journey of healing and care, which is evidence enough that our communities have what they need to get the help that they need. You know what I mean? And I always say this because I always used to get annoyed how everyone's always like, well, on this chart, Black women are always at the lowest, and that level are always at the lowest, and so I remember always saying to my kind of myself, it was kind of like a chant, I guess. I'm like, we may be in a resource deficit, but we're in a love surplus. Because we are always there and always continually caring for each other, whether we know each other or we don't. And it's really important to make sure that we realize that, that in this system we may be behind, quote unquote behind, always disproportionately impacted in X, Y, or Z, but it doesn't take away from what we're capable of doing and what we've already been doing for centuries. Like I was like, there was a world before all of this, you know what I mean? Before the system as we know it, that we're so afraid to touch and change. Life existed before that. Life existed before modern medicine. Life existed before all of this and that. We can change it. We have to just dare to have the courage to make that change happen.
This has been an excellent conversation, and we're coming in on our last question. I really wanted to just turn it back over to you all. Any sort of last reflections or thoughts you may have, especially considering this wonderful conversation.
For me, in terms of my final thoughts, I want to really talk to the women that are victims, right? I want to tell the victims that you are still heard, we still hear you, we still love you. You can still come to us, we're not tired of you.
Yes.
We see you, we welcome you with open arms, and we want you to heal, we want you to be free, we want you to have a life that is flourishing and that is beautiful, and no matter what you're going through, we'll still here for you, we still love you. Secondly, for the victims, if you are experiencing domestic intimate partner violence, The National Domestic Violence Hotline is 1-800-799-7233. That is 1-800-799-7233. So if you are experiencing domestic and intimate partner violence, please reach out to somebody. And whether it's a call, whether it's our informal networks like we talked about, reach out to somebody to get help. And then I have practical steps before I turn the floor over to my sister for us to be able to serve, to better serve women that could possibly be in a situation or survivors. Number one, I want you to be able to identify a place or shelter. So make sure if you're listening to us or you're watching this video and you need that you identify a place or shelter that you can go to if you choose to escape. Staying with a friend or family member may be an option if your abuser won't be able to, if you can't find a home. So turn to a family or friend if the door is open. As a friend or as a family member, if you don't mind and you're open and your heart is, willing and you have the capacity and you can take it on, we ask that you would reach out to your friend or let them know that the doors are open if they ever need a place to stay. So that's another thing. Keep stashes. Make a getaway bag, personal items. So like we were talking about earlier, copies of your important papers. Hide it well in the house, camouflage it in the house. If your abuser is controlling and you don't know what the situation is, you may want to even hide food or whatever, so that you can be able to eat. That's important. Menstrual supplies or anything else that you may need in the bag. Be prepared to provide for your children as well. We talk about packing their birth certificate, their school paperwork, their social security cards, all of those identifying information, an extra set of keys in case they take the keys. Make copies when you're out to have an extra set of keys. Put all of those things in a bag and hide it in case you ever decide to leave or you're prepared to leave whenever you're ready to leave. Keep your gas tank full. When you're parking your car, never pull your car in or back your car in. Keep your keys close by to you just in case you decide to escape. If you don't have a car, but you have Uber, you have an app, make sure that you're able to easily access that app and that it's somewhere. Clear out your phone with unnecessary apps and only put what you need on there in order to be able to quickly to connect with the people that you need to. Have a friend check on you. So y'all can create like a distress signal, even if it's something signal and simple in terms of like a text message. It could be one word, it could be one number. If I text the number 2, I'm in danger, I need you to meet me at a certain place. Put distress signals in place so that you can, so that your friend can help out. You could also create SOSs so they live close, so you want to just flick in lights and things like that, or if they could come over and help you could do those type of things too. And also lastly but not least, you want to make sure that your children are prepared for the plan. So you need to let them know that if you're going to plan on escaping, you're planning on leaving, that they know if they may have to go into hide, where's the hiding spot, where do mommy meet or whatever, or where do daddy meet, depending on what the situation is in order to escape. So make sure that the children know the plan too. But most importantly, just know that we love you, we're still rooting for you. Our arms are open, your story is not old to us, and that we still hear you and we still want you to survive.
Thank you so much for that. This is really important. Only other things I would add is first on top of what you've shared is, whether you're documented or undocumented, there are resources for you. You still deserve the help that you need in that process, and there are people willing and ready to be sensitive of your case and whatever that may be. You don't have to have a checklist of things you've already done before you get help. You could still be living with your abuser when you reach out to get help. You could have, tried to reach out many times before and decided against. Whatever time you're willing to reach out when you're ready. And if you know someone who needs help, the most important thing is to be there and to remind them that you are always there. Many survivors that we work with can definitely share that if they had someone else that they could rely on or lean on or get help from, that would have been the most ideal option, someone that they could trust and not make them feel judged, someone that shared their language of their culture or an understanding of what's going on would have meant the world. Right now with Domestic Violence Awareness Month, with TPC, there's a campaign that we're running, there's 2 actually. One is called the Be That Person campaign. We all probably have heard like, oh, don't be like that person, the one who's usually the loudest, the one who says something controversial or has something to say that rubs the status quo the wrong way. That's the kind of radical activism we need in our communities, to realize that we are one step away from changing everything for survivors in our communities. Being someone that when they hear that someone is a victim of an abuser, whether that abuser is beloved, whether that abuser is a leader in the community, whether that abuser is someone that you respect out of lineage or out of relation or whatever, your priority lies to survivors first. Because there's never harm in believing in a survivor, and then allegations don't work out. You still believed in someone that could have been harmed. Your priority is in taking care of people who could be victims of horrid abuse in whatever form that may be. No form of abuse is more important or justified or valid than any other. You don't need to have bruises or scars to be a victim of abuse. And on top of that, it is just really important that we are willing to ask questions, to push back, to imagine, to truly, it is a radical thought, to imagine a world better than the one we are in right now, to not affect defeatism, to not affect an idea that the way it is always what it's going to be. We can look back 10 years, 20 years, 30 years and see that everything has changed. And many of those things have also stayed the same. And so our work is really just based on ensuring that we hold on to this life force of hope, because hope is at the center of violence prevention and intervention, but hope is also at the center of healing and restoration. And those truly go hand in hand. So when you're looking on how to help people in these cases, give not only with your time, but also give in the way you speak to people and getting engaged and getting people to talk about this regularly, not just once a month or once a year. And also just give in whatever resources that you have. And I usually put more onus on people who have money to spend. So businesses, institutions, companies, the money that wasn't yours that now gives you the life that you have, give that to communities and people that need it. A lot of our survivors are in need of direct cash assistance. Not having to jump through hoops to get $1,000, to be believed when they say their children need food and their house needs to be cared for. So by being able to offer that through organizations like TPC and through community members themselves, we give people a sense of safety, and we also get to answer their needs right away. Because if someone gets to feed their children, maybe then they'll be willing to follow through with a counseling program. When somebody gets to make sure that the roof over their head stays in place, then maybe then they'll be willing to get the care that they need to change their lives and to better their lives for themselves and their children. So no more giving survivors ultimatums. It's time to give them their due right, which is an opportunity of a life that they choose.
Well, thank you all so much. This was an excellent conversation. I really, really deeply, this has just been a really insightful conversation, very innovative, made me feel full. I'm so sure folks watching, those who are there, really here, really appreciated everything. So just thank you all so much. It's time for time to get another discussion.
First of all, I'm here and so much. It's so great. And so my name is Nawai. I'm the case manager and outreach specialist, and I'm so proud of what we have done and wanted to put myself loosely for. So my question is, your research is great, and so my question goes to the research piece. And so we have the challenges in around senior community and from appreciate when I see my community just after everything, so Washington DC for so long, and doing their work, and when the victim called a police in 911, either, the abuse, the victim or the children that line up in the house or the neighbors, and the abuser would be the ones there to the police, either whomever that show up during the call. So at the end of the day, the survivor or the minor, like the 10 years old, has been translated for this month.
Yeah.
So we have a challenge in really like seeing that in our community when that women went to the court, the case will be turned down, even though you have to choose. And you don't see that much like navigating. Of course, there is a language access, but that's a different story. But seeing that when you order to talk about systematic justice, so on, but seeing that in the community, how can we eliminate that, or what would the research piece say, or if not in the past, like considering that in the future, like help us out or risk to those like women, because in our culture we have been taught don't say anything. There's a woman like did someone hurt you? Yes. Is that a man or woman? You got raped? Yes. Like men? Yeah. Shh. That's how we go on. So here we are here to present an advocate, but it's still like a challenge. But we had a case that I knew we were discussing earlier today. I'm abused, this happened to me, and I'm not going to claim that either. So I just, okay, we respect that. It's in your culture, but still, it's not okay to be experience that in here, since we are here. You're not there anymore, right? Here. So go back to my question. What would be like the suggestion? Anything like seeing from like your side for research?
I want to make sure that I understand your question. So the first one is a question that's about, well, number one, you asked a question about communication with the children actually translating for the parents, right? So one of the things we need to advocate for, when you told me that, I used to work for the government and I used to work for the Small Business Administration. And so businesses are run by everybody from different cultures, different people, everybody. So when you work for the Small Business Administration, they call into the normal number. But if you need a translator, they transfer you to a person that can translate for you. So in terms of the National Domestic Violence Hotline, or hotlines that we're going to put out there, we need to attach a system that's similar to the one that's in the government that will translate you to people that speak your language, which would mean that we need to hire Somali people or people that are in different cultures that can be, bilingual, that can kind of speak to these different populations. So that would be one in terms of policy. But whatever, we can advocate for those type of policies with the National Domestic Violence Hotline. So that would be one. And then the second one would be in terms of raising awareness. From a research perspective is I would need to understand the community better, right? And I would need to understand the community's perspectives better and what they need better. Going back to what my sister said, and what I would want to do is I honestly want to start with a focus group. What's the conversation around these taboo subjects? What would be their suggestions? So kind of putting the focus groups together to find out what's going on in the community, and having different generations at the table would be probably equally as important. So we can have young people that's outspoken and don't mind asking hard questions, and other generations talking about whatever the challenges are at the same table. So number one, we can kind of start with where are we before we can go forward. And you don't necessarily have to have a research project to do that. You can have community forums where it's kind of like what are they called? The community talks, like when you're getting ready to like merge. They have it when they're getting ready to merge like a white community with a black community. A town hall, like a listening session. They'll start to pull people together in order for us to have these robust conversations, and then together we come up with a plan on how to go forward. And so that is something that you actually could implement now that you don't. The research is equally as important. So the data, if you're gonna have it, we may as well collect the data. May as well collect the data if you're gonna have it. But outside of that, in terms of being able to immediately impact the community, without the RD process of all of the stuff that comes with particular research. You can kind of have these town halls and meeting sections to start to have the conversation safely, where nobody is, we're not telling you to leave your business, we're just giving your opinion. We're just having a conversation, on ways that we can possibly move forward. And then y'all as the leaders who know all of the information and know some of the barriers in terms of the institution, y'all can put together a plan in order to be able to go forward more efficiently and more effectively. So that would be my answer. Did I answer?
Yes.
Okay.
I think one other thing that Nawai mentioned was, once again, just really attributing to the complexity of what we're talking about here. What she mentioned is a survivor who doesn't speak English, but the partner does, the abusing partner does. If the police were to come to that home, who's going to be out face to face with the police? Who is the police going to respect?
Yeah.
Whose story are they going to understand? Because they don't have her. Then she talks about another perspective where the child witness is the translator.
Right.
So the child is not only witnessing the abuse, now they're put squarely between the parents and the police.
Right.
What story is that child going to tell?
Well,
Because they know that the father is abusive.
Right.
They know that the police don't know what's going on. They probably know that what if a parent is undocumented? Now that child has the burden of what will happen after this conversation.
Well, in terms of a vulnerable population, children are part of a vulnerable population, and there should be basic. I was a police in the military, so I've only 5.5 years, but I have a little experience, as a police officer. The children are a vulnerable population, and you're not going to question a child, but the parent has to give permission or whatever, and so it's a vulnerable population, and the police are not going to be able to do anything with their child until the courts get involved and the court say what can happen with that child. So the child, in terms of police response, would actually just by the legal system wouldn't be able to speak on behalf of either or whatever, if the police do it right, we know that they do things wrong or whatever, but if the police do it right, which is part of the training, they're not able to question that child. They have to give permission, and that they wouldn't be able to decide who or whatever. They're gonna put it back on the courts. So that's the first thing. In terms of the police, we talk about, I didn't talk about it, it is in my notes. We talk about culturally sensitive training, with police officers, which we have within a Black race, and them just speaking English or whatever, they just automatically have their assumptions. So I don't know if, in terms of how we decide which career fields we want to go in. I don't know many Muslims that probably want to be a police officer, and so there's that, who actually really wants to go into that field and infiltrate that field. But even though you're not necessarily a police officer, you can serve, you can get hired on as a person that does cultural pieces for the police department to make people more aware. Now, what I would think in terms of how we can go forward in collaborations is partnering with organizations like yours or social services organizations that can bring in other people. Because we're thinking, when you bring up those kind of topics, now you're talking about reimagining policing.
Yes.
So if we was to reimagine a perfect society for domestic violence victims and police, what would that look like? And how do we address our situations that don't necessarily lead to guns or shooting and citing or whatever, then it would look like a collaboration with the right people at the table to take those people and to put them within the institution to create jobs for them so that they can start to address these issues in a very different way. And then it would go back to us having open conversations with what is needed. We would still have to start with what is needed and who would even be interested in serving in this capacity to help people.
I think all abolitionists everywhere, their ears just perked up. This is a point I like to make a lot of times, is that we are actively working towards reimagining what violence response will look like, but we have to also realize we are still functioning within police systems, we're still functioning within a carceral state. And so it's important for us to do two things at once, because we can't just be serving generations to come without helping generations that are here.
Right.
And so it's important for us to realize, we know how to walk and chew gum. We have to walk and chew gum while balancing on a ball and jumping jack at the same time.
Right.
And so we have to be able to do both those things. But what you just proposed is really critical.
And I think, to your point, or whatever, this is not something that necessarily have to be a delayed process, right? So we're talking about not even getting to other work. We could talk about defunding the police, right? Or whatever. So if you talk about defunding the police, and you take these resources and you reallocate these resources in the community, where we're bringing in people that can address particular communities, or whatever, or culturally sensitive people, or whatever those needs are that we decide, as a community is needed, and we reallocate those funds from guns and mace, whatever they find, all their equipment and stuff, or I hire extra police and we don't necessarily need them in certain communities, or whatever, and you put this money back into a different person in order to be able to better address the needs of domestic violence victims, then we're just reallocating resources, and that is not something that we need to wait on. There is a person that's sitting in the city at the city, on the city council, or whatever, they can make those kind of decisions instantly. But that leads back to advocacy and what we want to do as a people in those spaces. Or are you going to go up there and say that this is what we want and this is what we need, and get the people behind you to push for the city to make different decisions when it comes to policing? It does take work on our part too, but I don't feel like that has to be a delayed process.
Great conversation.
Well, just the beginning. It was a great conversation, but hopefully it'll be, we can continue the conversation.
I think you understand.
Thank you so much. This was great. And so I think we can close it out for the evening. If folks want to chat a little bit, do that for maybe a few more minutes, and then we can get on out of this very new room.
That's right.
Oh, the whole hall. I was like, what's up? Where is this monkey dancing carpet? I was trying to use this one. Oh, yeah.